Hey guys, so today I'm here to do my 31-week update. I don't have a ton to update you guys on, but the majority of this video is going to be my birth plan, as well as just a general overview of my hospital binder and documents-wise, things like that, what I am bringing with me to the hospital. And then also I have a little friend here, Daisy May. This is like her spot on the couch and she was sleeping here, so I wasn't gonna make her move. So she's going to chill there throughout the whole video as well. So we'll go ahead and get started first with the updates on pregnancy-wise, what's going on with Revelyn and with me, and then we'll get into the birth plan at the end, as well as stay tuned because I'm going to announce some exciting videos that are coming to you guys because now we're nearing the end of the pregnancy. There's a lot of videos that are going to be coming your way soon. So hopefully you guys will be excited and I'll tell you about those at the end. Okay, so currently for Revelyn, according to my app, she is currently the size of a pineapple. She's between 15.2 and 16.7 inches long and between 2.5 and 3.8 pounds. She is also doing some major brain and nerve development currently, as well as eye development. Her irises now react to light and all 5 of her senses are working. It also says that she is probably rotating into the birthing position with her head down, and she is good enough at breathing now that she is doing so rhythmically. Other than that, updates for me is that she definitely has gotten a lot bigger. I can definitely tell because my acid reflux has gotten a lot worse. When you're pregnant, your stomach obviously gets squished because the baby takes up the room, and so it pushes acid into the esophagus, causing acid reflux. So now it actually happens, even not pertaining to certain foods. It just happens a lot and it's worse, especially if I lay down. So there's that. And then also I have gotten a few ligament pains. I have gotten some stretch marks. I have told you guys before that I had stretch marks already on my hips from when I gained about 25 pounds in like a 7-month period in high school. And I did get a few stretch marks. I kept forgetting to tell you guys, I actually got these stretch marks back in at 24 weeks, I think, but I haven't gotten any more since then. I did find out from my mom that she only ever got them on her hips as well, so there's a good chance that that's the only place I'll end up getting them because I don't have any on my stomach or anything. And because I haven't gotten any more since 24 weeks, but I've gotten a lot bigger, I don't know if I'm gonna get any more, I'm not sure. So we will see. Even if I do, I'm really not that worried about it. Obviously, they're not that pretty and nobody wants stretch marks, but you get something so wonderful out of it that it's just worth it. So I'm not upset about it at all. And overall, this pregnancy, I can't complain about a lot. I've had a very easy pregnancy compared to a lot of other women. I've been very blessed in that aspect to just have a very laid back, easygoing pregnancy. I really haven't struggled or had discomfort till now in the 3rd trimester. Going along with discomfort and stuff, it's a lot harder to sleep now. It's like a mini workout every time I need to change sides. But other than that, like I said, I can't complain. I get something so wonderful out of it. I get a baby. And so I'm really not that worried about it. There are so much worse things that could be going on in my pregnancy that it just seems very minuscule. I also, though, am out of breath for sure. There's been a lot of people mentioning on our daily vlogs that I sound winded, and she is crowding my lungs now, so especially like talking long amounts of times like this to the camera, I start sounding winded, which I am right now even. But other than that, there really isn't that many more updates for you guys regarding me and the pregnancy and Revelyn's growth. So now I'm going to get into the birth plan side of things. To kind of make it a little easier for you guys to see, I'm going to insert close-ups while I'm talking so you guys can really see what it looks like. This has my birth plan in the first pages, and then it has a bunch of other things as well, which I will show you guys too. And make sure to tell me if there's anything documents-wise or anything like that that you guys brought that maybe I didn't think of. But I'm hoping that I remembered everything. I did a lot of research online trying to find out what documents I need and such. So we should be good, but we'll get into it. I do want to preface that I know that a birth plan probably never goes the way you want it to. In a perfect world, it might, but it's still important, of course, to have one because there are things that you will have control over. But for instance, if I wasn't able to talk or I was out for some reason or something, my husband could easily pick up this and read the birth plan and know what it was that I wanted done. So, and everything I've discussed with him as well. So, I just want to preface that, of course I know in a perfect world it would all go as I wrote down, but that's just not the case sometimes. So I still though have everything written down, and I will give you guys kind of an overview. Let me know if there's anything that I didn't include in my birth plan that maybe you guys did, because obviously this is my first baby. I did look up birth plan like examples, and there were a lot of things on those that I didn't even know I needed to know about. But there might be more things, so just let me know below. So opening it up, it is the first page of my birth plan, and it just has things like attendance and amenities. So the people that I want there during labor. I am kind of more private when it comes to this thing. I'm really only comfortable with like my sister and my mom and Ryan obviously there. So during labor, I have permission for my husband, my mom, my sister, and our photographer. She's actually my sister-in-law, that's why she has the same last name. She is going to be photographing the labor and delivery, and so obviously I want her on here to make sure that she is good to be in there. And then only the people during delivery will be Ryan, my husband, and again our photographer. So some additional things that I wrote down is I do have a personal labor and delivery gown that I've ordered off Etsy, which you guys will see as soon as I get it. And then I want personal music during labor, but not during delivery. And then filming and photos, of course, allowed during labor and delivery. That's an important one, especially considering we're daily vloggers, so we are recording the birth of Revelyn. So we want to make sure that that has no issues, and we're good to go with that. So the next thing is things regarding labor. So once admitted, I'd like my husband to be allowed to stay with me, my service dog present during labor only. Of course, they can't deny him anyway, but I want to make sure it's written down so they don't try to fight me on it when I'm, you know, in the middle of labor and in pain, so I can discuss it with my doctors beforehand so they know and are aware of it. So also, I only want a doctor, nurse, and attendants, no residents or medical students. Oh, I noticed I put of. But I am, like I said, I'm kind of a personal person, and I want it to be more of an intimate setting. I don't want a ton of people in there, which is why I literally want just the minimal amount of medical people necessary in there at the time. And then also continued contact lens wear care unless C-section obviously is needed, and then no food restriction unless absolutely medically necessary. And then as long as me and my baby are doing fine, I want to stay hydrated via clear liquids instead of an IV. I have intermittent instead of continuous fetal movement monitoring. I know if you have continuous fetal movement monitoring, you aren't always able to actually walk around during labor and such. So I definitely also don't want to be strapped to fetal movement monitors at all times if it's not necessary. I just think that it's pointless. If my baby's fine and I'm fine, then I don't think it's needed. So that is just my personal opinion. So I would also like to shower if labor becomes too long, and obviously there is nothing medically wrong, then I would like to be able to shower. And then to just progress naturally, I do not want to have special medications to make labor go faster and such. So when it comes to pain relief, non-medicine wise, bath, shower, breathing techniques, distraction, and massage. Medicine, I am getting an epidural. If you guys did not know already, I did discuss why I am getting pain relief during pregnancy. I have PTSD, panic attacks, and the pain of things, obviously it will not be gone completely, because my doctor actually told me that you get like pain medicine up until the delivery, but obviously they can't give it to you right before because they don't want the baby to be sedated. So you get an epidural, and you can feel stuff, but it's just enough so you can push, but it's not a ton of pain. So I am getting one based strictly upon making sure that I am as calm as possible, because that is one thing I don't want to worry about, is my anxiety being even worse, because I'm trying to worry about all of the pain as well as getting my baby into the world safely, if that makes sense. So I did talk about that more in depth in a past video. I'll try and find which one it is and link it below for you guys. So on page 2, I talked about things that I would like for vaginal birth. And I definitely plan to have a vaginal birth, but of course you need to have your wants for both C-section and vaginal in case something goes wrong and you need a C-section. So for vaginal birth, I'd like to risk a tear rather than having an episiotomy, which according to my obstetrician, they already do that. They don't do episiotomies, they just risk a tear instead. So that is something I wanted. And then also only the minimal medical personnel needed present, like I mentioned with labor as well. And then also during the actual birthing process, I am not going to have Levi in there with me because it's only going to be my husband, the photographer, and me. There is not going to be anyone to make sure, obviously, that Levi stays laying down because he's a service dog. If he hears I'm in pain or upset, he's going to try to get up a lot. With being in labor, it's not that big of a deal, but actually giving birth, we don't want him getting in the way. So my mom is going to take him at that time when it's actually time to push. So he will not be in there during the actual delivery. So after birth, if it is a vaginal delivery, then I'd like immediate skin to skin to hold my baby right away, putting off any procedures that are not urgent. My husband to cut the umbilical cord and to breastfeed as soon as possible. I am breastfeeding. And then if I do have to have a C-section, then I would like my husband to be present at all times, photography and video still allowed. And then also my husband to hold our baby as soon as she is just kind of quick cleaned off, and as long as she's obviously medically okay, to hold her as soon as possible, because when you're in a C-section, you aren't able to hold your baby right away. But I obviously want my husband to hold her right away then. And then also to breastfeed as soon as I return to the recovery room. So this is the last section of my birth plan, and postpartum wise, after delivery, I'd like all newborn procedures done in my presence, so in our room, and then my husband to be with our baby if I cannot, and to meet with a lactation consultant. And then also I said, please do not offer anything to my baby without my consent. We do plan to do like pacifiers, but only if absolutely necessary. I'm not going to make it like, oh, she's crying, stick a pacifier in her mouth. It's going to be the last resort. I do know that thumb sucking also is a lot worse dental wise, so obviously I would rather her suck on a pacifier than end up having major dental issues. And I had perfect teeth, I never needed braces or anything, and I had a pacifier for quite a while. I just know that obviously it's hard to break them from it if they have it through many years of their life. So I'd like it to be last resort, but I am still open to it. But of course, I don't want the nurses or anyone to give her a pacifier because I want it to be the last resort, and so I will make that decision if we do go that route. And then I am breastfeeding, so I don't ever want them to offer her formula or anything like that. And then this is something I added after watching Cullen and Katie. They were talking about how like they literally, the nurses would come in all the time to check vitals like every hour. Like it was a ridiculous amount of time. And I was like, that's something I want to add in here to make sure that I speak with my doctor about and the nurses, that there is not vital checking absolutely more than necessary. Because obviously after having a baby, you want to relax, spend time with your baby and your husband, and not be, you know, having nurses and stuff come in all the time. Obviously, I know they have to check vitals and do things like that because that is their job, but I want to make sure that it's not done any more than absolutely necessary. When it comes to feeding, I just wrote down that I am going to breastfeed exclusively, and I would like to feed her on a schedule unless we're having latching issues and stuff like that. I would like to have a breastfeeding schedule, not just a feed as she wants. But I obviously want to make that known to the lactation consultant, but obviously if she's having latching issues or we're having feeding issues, then I will not be paying attention to that fed on a schedule thing. I'll be doing whatever the lactation consultant says that I should, so that we make sure that she is feeding properly and breastfeeding properly. And then the last thing is just saying that I would like her to be in our room at all times unless I ask for her to be taken to the nursery. I know some people just ask for the baby to be taken to the nursery for a good amount of time. I'd like her to be in with us as much as possible, and then say if I just need a break or something, then I have the option still to send her to the nursery, so that's just on there as well. So the next page is contact information, and this just has contact information for my parents and just doctor, like my family doctor and stuff like that. This is something that's already in my emergency binder that I just put in here just in case, and it just has all of that information. I'm obviously not going to show you the page behind it with the actual contact info because I don't obviously want to give away numbers and stuff like that. So that is what is there. Then the next page is insurance. So this has all of my medical insurance documents are behind that initial page. And I just keep everything covered like that, so if anyone wants to look at my binders and they're over, you know, they're not looking at all of my information and stuff, so that's why I have like those pages in front so you can't actually see it. And then also it comes in handy when recording videos or taking pictures to show people because obviously you don't want to show the world your insurance information. And then the next thing is important documents. Now I have my medical information, which is something that's been printed out on in my emergency binder for a while, and on here it just has my basic information like my name, gender, birth date, height, weight, family doctor information, hospital information, immediate care information, medications that I've been on in the past, allergies to medications as well, and then medical history for them to be aware of. So this is more if for some reason I am not coherent enough to answer questions, my husband can easily take this out and answer any previous medical history questions for them that they may have. And then the other page has in here, I don't think I will need it. I saw a couple people mention about needing a marriage certificate. I don't know why you would need it, and then there were other people that were like, no, you don't need that at all. But I just put a copy of mine in there to make sure that if I needed it, I at least had a copy of it. And then because I had a name change, a lot of times I had issues with places believing what my name is and that it was changed and such because the stupid Social Security office didn't input the information into their system even though I legally have a changed name. So I just have that like main case closed, the actual thing that says this is my legal name in here in case I have issues. Then at the end, I just have 3 empty ones because I know a lot of people say that when you go to the hospital, you get a ton of paperwork. And like her birth certificate as well, I want to make sure that I have space for that. So I just have 3 empty ones to keep her stuff in and any paperwork that I get from the hospital to put them in here to go home. So that is it for my birth plan and my hospital binder. I hope you guys enjoyed it. Again, let me know if there's anything that you think I missed or if you have a different opinion on something. Obviously, this is my first child, so there's a lot of things that I might not completely know about. So if you guys want to let me know in the comments below, I of course will take your constructive criticism and ideas into favor and make sure that I have everything that I need in my birth plan wise. So there are a lot of new videos coming your way that are going to be out of the norm from a normal pregnancy update video because we're getting to the end of the pregnancy now. So there's a lot of new videos to tell you guys about. So the first one is, yes, I'm going to be doing a what's in my hospital bag. And then also I think I'm going to do a separate what's in my diaper bag depending on how long it is. And then also there's going to be my newborn cloth diaper stash video, which will probably be the beginning of December. And then as well as how I got a free breast pump. So that's exciting. I'm going to do a video on that as well. And just a few other videos as well coming your guys' way. So I think you guys will be excited to see kind of new things coming on this channel because we're getting to the end of things. So there's more things to talk to you guys about. So it's exciting. Also, I did want you guys to let me know in the bottom bar things that you include in your hospital bag. This week is kind of like my week. Well, this next 7 days is kind of like my time to start packing my hospital bag. I've started a list first with everything on it that I want to include in my hospital bag with check marks of purchased and packed. So I make sure that I have everything first purchased and then I check it off that it is packed. But I want to know things that you guys brought and used or things that you wish you had brought to the hospital. And also let me know things that you brought to the hospital and you never used at all, because there might be some of those normal things that people think to bring and I already have on my list, but maybe you found out you really didn't need them at all. So I almost forgot to show you guys my belly shot. Actually, I did forget. I had to get back up after being done editing and shoot it for you guys. So this is my belly at 31 weeks. This is what it looks like from this side. So the front, pardon the stain if you can see that. I don't know how I got it. I think you can kind of see that my belly button sticks out. And then this is this side. And I'll show you the back. So that's it. 31 weeks. I hope you guys enjoy this video. I will see you guys next week with something different. It may possibly be a what's in my hospital bag, but I'm not 100% sure yet. But whatever it is, it will be exciting. And I will see you guys next time. Bye.